Gamification tools will be active, so score points by engaging with the platform's different elements. Join a live session, there's 50 points earned. Make a connection with another delegate on the platform, 100 points. Ask a question in a session or engage with one of our exhibitors in the digital marketplace, another 50. You get the gist. At the end of the event, those who finish in first, second, and third places respectively will have 250, 150, and £100 to donate to a charity of their choice, or receive this in Amazon vouchers. But of course, you can only be in with a chance of winning by engaging with all of the great content that we have to share with you and your fellow delegates. So do get involved. So there's a bit of background. Let's move to the focus of today. The NHS has more than 1.3 million staff, making it one of the world's greatest employers. But with demand for healthcare continuing to rise, even after the pandemic, we need to ensure staff properly by protecting the NHS's most valuable asset, its workforce. The NHS long-term plan, which was released in 2019, described the steps that must be taken to guarantee NHS employees are capable and equipped to provide the greatest possible service to patients. The topics that arose include prioritising employee well-being, improving support leadership, upskilling current employees, and recruiting new employees, all of which should help address the problems that our NHS workforce faces. And these strategies will be key themes in today's conversations. We also have great networking opportunities throughout the day, which can be accessed via the speed networking function. And I encourage you to collaborate with your colleagues as another great source of education. This all plays a part in the community that we're growing to extend the reach of knowledge and connections shared today, which can be accessed at any time to fit in with your busy schedules. Also on the NHE 365 platform, access to a wealth of resources on our on-demand content alongside the digital marketplace, providing valuable expertise for you and your teams to digest at your leisure. Finally, feel free to share your thoughts and experiences today across social media using the hashtag NHE365. That's hashtag NHE365. So with the scene set, let's dive into our first panel topic, training and apprenticeships. Training and apprenticeships are critical to assisting healthcare organisations upskill current employees and providing a pathway into the NHS for new employees, all of which contribute to the development of a better workforce. As our NHS starts to recover from the past 2 years, this panel discussion will bring together a group of healthcare professionals to look at the critical role of continually sharing knowledge and developing staff professionally. Whether the staff are already in the industry or perhaps are new to it, development can be provided at every stage to better the workforce and the care given to patients. I really like to try and make these debates a conversation with you included in the dialogue. So please do try out the Q&A function at the bottom of your screen, and that'll allow me to pose some audience questions once we get going. So let me introduce you to Jonathan Bourne, Managing Director of Damar Training, Dr. Kalwant Sidhu, School Education Lead, Reader in Public Health Education, School of Life Course and Population Sciences, Faculty of Life Sciences and Medicine at King London, and also Jenny Stone, Apprenticeships Relationship Manager, London Region at National Talent for Care Team Health Education England. So it's great to start with a full house of panellists. I'd like to say a very big welcome to you all. I'm at that stage where I need my glasses on now. Good to see you all. Oh, now I can see you. Now you're in focus. Jonathan, from Damar Training, let's start off with you, if we may. I mean, the NHS is one of the world's biggest employers. What opportunities does that create for apprenticeships?
Helen, thanks to welcome all. I think there are so many, it's hard to know where to start really. So just to kind of get the conversation going, I thought I'll give just one, and that is the opportunity to use the very size of the NHS as an organisation to scale the impact of apprenticeships. Let me give you a real life example that actually came across my desk just a couple of months ago that I think illustrates this quite well. we deliver apprenticeships in non-clinical settings, so administration, management, various support functions, and this relates to it was one of our business administration apprenticeships at a trust in Greater Manchester, and she was working in a team that manages the flow of patients through the hospital. Part of her apprenticeship, and this is the case with many apprenticeships, is a project that has to include some kind of process improvement. Now, she noticed that the trust she was working at was making really quite inefficient use of pre-booked ambulance transport for getting patients home. And consequently, they were spending a lot more with private hire companies than arguably they should have been, and overnight stays where patients couldn't get home on the day that they were discharged. So she spotted a problem, developed a project in partnership with her coach at Damar and her supervisor, and that project involved working with colleagues and the North West Ambulance Service to implement changes which resulted at her trust in a 90% reduction in private hire journeys and reduced unnecessary overnight stays. Now, she got a distinction, as you would expect from that project, but what it got me thinking about in the context of the NHS as a whole, and the many trusts that there are out there, is wouldn't it be great, and what a fantastic opportunity there is to share examples of work like that and best practice like that. This is one of thousands of apprentices across the country, many of whom will be coming up with really good ideas, and given the the pressures on funding and the pressures on NHS generally, what an opportunity there is to use that imagination and that talent, often at quite junior levels within the organisation. So leveraging the energy and the excitement and the ideas of apprentices in the workforce across this huge organisation, I think that's one super opportunity that we have.
That's such a lovely example to start us off with, Jonathan, and also I imagine some savings were made as well if there was a big reduction in private hire vehicles. But Jenny, it's true, isn't it? Apprentices sometimes look at things through fresh eyes, and I do feel father in hospital at the minute who's relied on the NHS for the last few weeks. I feel like our nation's health depends really in a way on the next generation of students and tutors. How have the NHS approached apprenticeships during the pandemic?
Yeah, absolutely, Helen. They really are the workforce of the future. During the pandemic, Health Education England, we've been here to completely support all of the apprentices in the NHS. We've been working with the training providers to ensure that any breaks in learning that needed to be taken place were taken place and fully supported. We worked with the universities if the apprentice nurses need to go, back on the front line. And also during the pandemic, we actually had our highest ever apprenticeship starts since the levy started. So we had 24,000 starts in the last academic year. So, I think that's just evidence to show you that, it's really embedded in the NHS now, and where people are really taking hold and using apprenticeships. Also, we worked really closely with the Institute for Apprenticeships and Technical Education with flexibilities for the EPAs. And that's really obviously impacted massively on getting the apprentices through their apprenticeship courses and finishing. And the introduction as well of the remote learning has just turned everything around now, and the accessibility that is now available overnight is just phenomenal. And also just that accessibility for, I'm based in London, but we have many apprentices that go Cumbria, Exeter, all over the country because of the ability to do that via remote learning.
I think it's always nice to see a bit of a silver lining to what was a dreadful couple of years for us. And, your example there of remote learning is great. Kalwant, before I ask you your first question, and welcome from King's College, just wondered if you wanted to add anything to what Jenny and Jonathan have just said there.
No, I think maybe this might link into the question you're going to ask me. My involvement, I guess, is more once that those apprenticeships are finished and those individuals are now established members of the NHS Workforce, and how we continue to support their education and training. And I guess one of the issues then is kind of creating that space and that capacity for individuals to be supported. That then can be quite challenging, because it means taking people out of the workforce in terms of kind of giving them time to engage in that further study. And then also it poses challenges on those individuals who are still kind of working in terms of making sure that there is adequate cover. And so, yeah, I mean, I think it's sort of great kind of putting money in to create new roles and new health professionals, but it's how we maintain kind of funding and support for that ongoing training and education.
We'll talk, Kalwant, in a minute about the different challenges in a bit more depth that staff face when they're trying to upskill, but how important is that need to upskill employees at all stages in the NHS?
I mean, I think it's absolutely kind of fundamental and core. We can see that there are ongoing kind of changes in medical science and kind of technology, and keeping up to date with all that information can be quite challenging. And particularly nowadays, there is just so much information available in terms of publications, opportunity to go on conferences. Everyone has an opinion on kind of Twitter. So there's just so much information out there. And one of the mantras of healthcare now is evidence-based practice, and kind of making sure that the services that are provided are underpinned with some kind of evidence. And I think the example that Jonathan provided was a nice example of that, where, you know, someone's kind of methodically looked at what was going on and then evaluated it and offered a solution that is kind of grounded in actually what's going on. And I think there's a danger that unless we teach our health professionals these sort of skills of how to look critically at evidence, then practice may be more kind of based on, you know, perhaps what is already known, or on, you know, not a great understanding of what is good evidence.
Yeah, no, completely. Jonathan, workplace planning in the NHS looks ahead, not just in years, but decades. So is there an example perhaps you can share with us on that front of how apprenticeships might be able to help us here?
Yes, absolutely. And apprenticeships, you know, as we know, that, you know, they are for the long term. It's not a quick fix, but, you know, this is an organisation that, as you say, is looking forward, needs to look forward in many years' time. I think one example that we've seen, not just in the NHS but elsewhere, actually, is around leadership. And I think we need to be thinking really quite proactively about our leaders and managers of the future. You know, leaders, as we know, aren't, you know, you're not born into that role. Sometimes you fall into it by accident, but in truth, you're developed and you learn from colleagues and peers, and you receive training. And I'm interested, for example, therefore, in how we work in partnership with employers to plan and encourage leadership development using apprenticeships. And sometimes that means making some quite brave decisions in selection processes, for example, and thinking about how we recruit. So, you know, rather than, you know, the instinctive lateral hire from inside the organisation or outside the organisation, someone who's an existing manager, thinking that we need to develop our talent into the future, identifying people with potential and supporting them into those roles, because that's what apprenticeships are all about, taking someone who's got the potential but isn't fully competent today, and then safely and supportively taking to where they need to be over a period of, in the case of management programs, anything from 18 months to 4 or 5 years for the highest level apprenticeship. So I think that's interesting and will perhaps necessitate some slightly different ways of looking at how we recruit. So rather than recruiting people who are already competent and therefore not increasing the pool of competence necessarily, taking on board in a supportive way people who have absolutely got the potential but aren't quite competent, and then safely and supportively getting them to the point that they need to be at. And that's certainly, I mean, we've seen that in management certainly, but we've also seen it elsewhere, and I'm sure it applies in some clinical roles as well.
As an apprentice reporter, well, many moons ago, about 100 years ago, I'm so glad there's a drive back to apprenticeships over the last few years, because certainly it served me well. And, I think there's so many people go to university, which is brilliant and needed, but some people don't, like I didn't, and learnt on the job. And it's great that there has been this move. I think, Jenny, according to Health Education England in 2020/21, more than 24,500 apprentices across the NHS began training in 178 different apprenticeship standards. I mean, that to me sounds really encouraging. And I'm just wondering if you can explain to us how the NHS uses apprenticeships to fill the workforce gaps.
Yeah, absolutely. And just to echo what you said, Helen, that's exactly how I've trained in my role. It's all been on the job training and apprenticeships. When I left school, and then it sort of went off the radar. So then it was on the job training, and now it's back. So, it's an amazing opportunity. Getting back to the question, filling the workforce gap, apprenticeships are the heart of workforce planning. You cannot have apprenticeships, in the workforce unless you have good workforce planning. And we say this continuously on every single webinar, every meeting we have. It's so important. And we're here at Health Education England to help with that. And there are business cases to ensure that, that those business cases are put forward to fill those workforce gaps. And it's about using, as people leave, to try and bring in that new talent to join the workforce and get onto the apprenticeships and be our workforce of the future. And interestingly, you said about the 178, the different standards. It's not just health. It's not, in terms of the health standards. And this goes back to what Jonathan said. In fact, London, a region, last year had the highest number of apprenticeship starts. The standard was senior leader level 7.
Wow.
So it just goes to show. The next one was nursing associate, which is the highest nationally, but for London alone, it was senior leader level 7. So that just goes to show you how we are certainly using the apprenticeships for our existing staff. So we're putting our existing staff onto those apprenticeships. But then what's happening is, it's making space for new entrants to come in and join the workforce for the future.
Kalwant, you're involved in master's programs. How much uptake from NHS staff? And as you answer that, my eyes are just going to flick to the right hand of the screen because we're starting to get some questions in. So if you take that one away, I'll see what we're getting in from the floor.
Okay, so I guess in terms of master's educations, we're then kind of moving away from that kind of core kind of training and learning, which would maybe a part of the apprenticeship or your initial registration, and about sort of developing those ongoing skills and knowledge to develop in your role. And I guess it's how, in terms of that workforce planning, those ongoing educational opportunities get sort of factored in, rather than once people have sort of completed their training or their kind of apprenticeship, then it's sort of seen as kind of job done. But how can we, I guess, kind of create that sort of notion of a learning culture where it's sort of recognised that just because you've got your certificate, there's still lots more to kind of learn and understand, and to as healthcare evolves, as new problems emerge, and we saw that very much with COVID, and how we kind of respond to that. So yeah, I think masters are a option, but it's also other kind of sort of training, short courses, other opportunities that we can give healthcare staff.
Two questions actually from Dr. Wen Wang, who is I think either panel 2 or panel 3 from memory, and they're both, I think, probably be good questions for you, Kalwant. I'll just take them one time. Dr. Wang says, how 50 plus to retain those who are aged 50 or over nurses? There are 245,000 nurses who are over 50 in the UK.
I think it's there's a kind of a pragmatic element to it, and part of that is actually kind of making sure that they're kind of given time. Sometimes with further training and upskilling, people don't always necessarily, they have to kind of fund themselves, or they have to kind of find that time themselves, which means that they're taking leave or kind of multitasking. So I think part of it is sort of making these opportunities as accessible as possible, and I think sort of closing the loop in terms of when we have kind of apprenticeships, we acknowledge that even though you're in your 50s and you might not have being kind of recently trained, there's still a wealth of knowledge and experience that you have that is still kind of relevant. So I think certainly how we sell these things is important. And
just briefly, Kalwant, and then I'll move back on to Jonathan. How you sort of touched on this, but how can we ensure that they have the time to learn and aren't discouraged by the technology?
I think it is actually in terms of perhaps this is much more a kind of contractual, and maybe also back to that kind of leadership level, where you are actually given study time, and it becomes part and parcel of you doing your job. And in terms of there's this kind of question about kind of mentorship, kind of making sure that opportunity to reflect and discuss what you're doing again becomes part and parcel of your job. So if there is sort of something that kind of gets picked up in terms of a learning need, then you're not that's not seen as a negative, or it's seen as you're kind of failing in your job, but that's actually seen as, okay, this is an opportunity now to sort of see how can we support you to develop.
Jonathan, don't really want to talk about downs, but what do you see as the biggest blockers to apprenticeship? Because let's face it, there are always blockers, aren't there?
There are. I think it's probably worth, if in half an hour talking about apprenticeships in the NHS, we probably do need to mention that 20% off the job element that I know is still seen as a blocker. I think actually as we get more used to standards and we understand actually how much more valuable they are by and large in the old apprenticeship frameworks, we can see that investment is absolutely worth it. But I've got a kind of quite a simplistic approach to 20 pass to the 20% requirement, which is that first of all, it should never be a barrier to apprenticeships. There are all sorts of ways to structure that learning time. Jenny mentioned that quite rightly the move to blended learning, flexible learning. That's what we do at Damar now. We have more one-to-one contact with our apprentices than we used to, but it's generally speaking like this rather than face-to-face. It's much more efficient and much easier. But really, I think it comes down to this, which is that if you have a member of your team with a genuine skills gap that is big enough to need an apprenticeship, and in really simple terms, that means that it'll take about 6 hours of learning a week for at least 12 months. That's your minimum size. Then think about it. What are the options there? You could have a go at filling that gap with commercial training, but it's almost certainly going to be more expensive than an apprenticeship, and it's unlikely to include that application of skills in the workplace and that impact and that assessment of competence that's so important as part of an apprenticeship. Or you could not train them at all, or just partially, and end up with someone in your team who has the potential but isn't fully competent in their role, and that's not great for patients, it's not great for the organization. Or if it's a big enough piece of learning that's needed, plan that 20% in and go the apprenticeship route, and that at the end of it, your colleague is fully competent in that role. And I think, short of, and this comes to that point about over 50s and people with other responsibilities, short of asking colleagues to study in their own time, which is bad for well-being, bad for family life, and isn't actually permitted by apprenticeships anyway, there isn't really another. So it absolutely is something that needs to be thought about and planned in. But if there is a big enough skills gap and you're working with a provider and you have those good conversations at the beginning, it absolutely shouldn't be a blocker anymore, I don't think.
We've only got 5 minutes left. So Jenny, I'm just looking at some of the questions that are coming in. A couple for you, I think, from Andrea. What about using virtual reality to do trainings and scenarios, simulations?
Yeah, and that's already happening. Some of the HEIs have already bought the technology. They were looking at it actually before COVID. I was at a conference pre-COVID, and they were certainly using that kind of technology already. So it's all it's already been pushed forward a lot more. But yeah, just definitely to use that. Obviously, we know that apprenticeships and the rules around apprenticeships are it cannot be sort of 100% e-learning, and I think everyone was a little bit nervous of that when we started saying about the blended learning and this remote learning, and then actually, because of the way things have moved on with this kind of technology, with the online webinars and the Teams and Google Classrooms and things like that, it's enabled so much with that.
Good. And Pam's also got a question that I think, Jenny, you could perhaps answer for us. How do we make use of the huge experience of pre-degree nurses that may feel they have less to offer?
Oh, I don't think anyone has any less to offer at all. Everybody has something to offer, especially sorry, say that again. It's the ones that they didn't do the degree, they went through the diploma route. Yeah.
So they might feel they've got less to offer, and I'm sure actually they haven't.
Oh no, not at all, not at all. I mean, you cannot buy experience. No, and I hope they don't feel that way either, because you cannot buy that experience and that knowledge and the skills that they've gained over the years. So no, I wouldn't say that should be an issue at all.
Kalwant, is there a distinction between training and education?
I mean, I guess typically training is always sort of seen around sort of a very kind of narrow focus, like you acquire a sort of predefined set of skills and reach a particular competence. And I guess education is very much about those sort of broader sort of transferable skills and that kind of wider education. So put simply, when the kind of protocol doesn't work, you can actually respond to something that isn't a kind of textbook scenario. But I think what we've been hearing about kind of apprenticeships is, captures the best of both. And I think what's really important about the apprenticeships is that application of that theory to practice. And sometimes that's one of the sort of criticisms of education, is that, people sort of learn all these like very abstract things, but that they don't have kind of relevance to the kind of reality of what's happening on the ground. So I think apprenticeships do allow that kind of immediate application of the training to practice, as well as that kind of wider education thinking, which again, the examples that we've heard today demonstrate.
Yeah, Jonathan, a huge amount of money has been invested in Kickstart. Are we missing an opportunity to link the scheme with apprenticeships, do you think?
I think we are. Kickstart is kind of winding down now, but I know there are lots of Kickstarters and lots of trusts who've used Kickstart, and it was initially designed. Lots of money's been spent on it. It was initially designed as a standalone program in response to the pandemic. There wasn't any link to apprenticeships, and I think as those programs now come to an end, there is an opportunity for employers. I know we've only got a few seconds. If you have a Kickstarter in your organisation, who you want to keep, who's got potential, who isn't fully there in terms of competence. An apprenticeship is the way to keep them and get them to that level of competence you need. So yeah, absolutely. If you're an NHS employer and you have a Kickstarter and you like them and you want to keep them and they've got potential, do talk to a colleague about apprenticeships, won't you?
I love the fact you're a solicitor, Jonathan, and that you're clearly on fire about apprenticeships. It's so nice to see. Jenny, we have only got a minute or so left. So I think, can we just end on the NHS Levy, the size of it, and is it being utilised?
Yes, absolutely. Conscious of time, but I just want to quickly say that only yesterday afternoon I did a event, online event for all the Kickstarters in London who have joined the NHS, and
Good.
I have just told them all about apprenticeships, how to apply, go to speak to their apprenticeship, please stay in the NHS and please get a job, and they're all absolutely buzzing to come and do the apprenticeship. So it's perfect. And I didn't even know you were going to talk about that. So the apprenticeship levy, yes, so it's approximately 220 million across the country. And one of the things with the NHS and what people don't necessarily understand outside of the NHS is that that 220 million is actually split over all the different hospital trusts, because they're entities in their own right. So it's not one big pot of money. And I always use sort of, M&S as an example. They've got one pot for the whole country. NHS is very different. However, we are on 80% of the spend of that levy and committed spend as well. And we also help with matchmaking for levy transfers, and last year alone we facilitated over 15 million in levy transfers out to the community in health.
Wow. I've got 30 seconds to give it to you. You trained as an occupational therapist specialising in community mental health and primary care. What drives you, what motivates you to make sure that training and progression is there?
I think it's that old thing about lifelong learning and that kind of learning kind of culture, that we've got to make sure that people remain curious and interested, and it's sort of, as I said, learning is sort of seen as a positive thing, and try and make it as enjoyable and as rewarding as possible.
Oh, well, you've all made our first panel discussion of today really interesting, and I'm sure the audience will agree. Thank you very much indeed to our first panelists, to Jonathan, Kalwant and Jenny, for kicking off the day with some great conversation. We're going to take a break now, time to digest what's been covered so far. And if you have chance, do engage with the speed networking functionality. Perhaps use what you've learnt as a bit of an icebreaker. Let's meet back here in 10 minutes time at 10:40. I'll see you then. Would you mind hopping me